Now, while there are very few cases of coronavirus in the New York area, health officials say that we can expect more.
Many are worried about how health officials will handle an outbreak. Dr. Max Gomez is here now with some answers to some pressing questions.
Dr. Max, we mentioned earlier in the broadcast about this woman that tested positive here, and they're saying that her husband will likely also test positive. Why are they not in a hospital, and why are they just quarantined in their apartment?
Well, the short answer is they don't need to be in a hospital, really. They're not sick enough to require hospitalization at this point. And like most coronavirus patients, their symptoms are relatively mild. 80% of corona patients will get better on their own, and if these two healthcare workers, in fact, stay inside their apartment until they get better, there's no risk that they will infect anyone in their building or anywhere else for that matter.
Now, the governor, the mayor held news conference today. They said expect more cases in New York because this is the kind of nexus of a lot of travel in the world. Can it be detected early enough to be safe?
I think so. I think so. Obviously, there's no guarantees when it comes to this sort of thing. But as Governor Cuomo pointed out today, this is not New York's first infectious disease rodeo. Our health department is one of the best in the world, and it has dealt with many disease outbreaks, such as various flu epidemics, including Hong Kong, swine, avian, and H1N1 flu. There's also been SARS, MERS, and, of course, most recently, measles. Now, for this outbreak, Mayor de Blasio has directed the health department to set up an early detection system so that hospitals and medical professionals will report corona-like symptoms to the health department. That data will be pooled to detect outbreaks and to direct resources to those affected areas quickly. So that'll be kind of an early warning system. We'll know exactly where things are and we can contain it.
And what about testing?
Testing is interesting because that's one area where we've really been kind of on the weak side, right? There should be enough testing now that the FDA and the CDC have released tests to local and private labs. The governor says the goal will be to be able to process 1,000 tests a day by the end of the week. The mayor says if you don't have a doctor, insurance, or transportation, call 311 and the city will figure out how to get you tested.
You know, we've lived through all those other situations you mentioned. This one just feels different. Is that true or false?
Well, it's maybe a little bit different, but it's, I think, partly different just because we were kind of slow to pick up on it. It came out of China. We weren't sure. Everybody kind of downplayed it at first until it really exploded. So it does have a little bit of a different feel, but we're starting to learn that it's an infectious virus very similar to the flu and some of these other respiratory viruses. Doesn't seem to be as bad as MERS or SARS, so it's probably going to be okay.
All right, Dr. Max, thank you.
Yes, thank you.
Do stay with CBS 2 and CBS N New York, and also CBSNewYork.com for the latest information on the coronavirus outbreak and what you need to know to stay safe.